So I've heard so many things about BMI in general,
Hmm.
and so tell me a little bit about what BMI is, and have the parameters for measuring BMI changed at all?
So it's a very antiquated way of measuring what is considered a healthy weight. It's an equation that takes into account someone's gender and their height and their weight. So it's basically a ratio of your height to your weight with some extra math in it. But it is very an oversimplification of what should be considered a healthy weight. We actually have research now that suggests that the BMI underestimates health issues related to weight for Asian populations. So, for instance, we see insulin resistance and diabetes in BMIs of 23 and above in Asian populations, and it also overestimates risk for people of color, like Black people. So we know that when we're seeing patients who are technically overweight or even class 1 obesity that are of Black descent, it's actually overestimating their cardiovascular disease risk. So we have to take the BMI with a grain of salt. There's many other ways of gauging what should be a healthy weight for a person.
So, what are some of those other ways of gauging a healthy weight?
So for me, when I am doing an intake for weight management, first of all, or like when I'm seeing a patient, first off, to gauge what their goal weight should be, there are a couple of different things that I take into account. So BMI is one because that's the most readily accessible thing that people know. So they often are like, I want to be whatever makes me a healthy BMI. But we have to think about what health means. So a healthy weight for me is one that supports your health. So you have well-controlled blood sugars, you don't have high blood pressure, your cholesterol looks good, and also your functionality. Like you want to make sure people are able to exercise, move about, and feel good within themselves. So when I'm meeting people and doing their initial weight management intake, and we're talking about what their goal weight should be, yes, we can take the BMI into account, excuse me, but it's also like their functional goals. Do they want to be able to hike a mountain? Do they want to be able to run around with their grandchildren? If they have any chronic illness associated with their overweight or obesity, having those in remission or under good control. And then we think about the BMI criteria.